Okay, how's that look, Wendy?
Perfect.
Okay, great. All right, thank you so much for having me, Wendy. I really appreciate you inviting me to speak tonight. And I know I see some familiar faces there already, so I'm really grateful for this experience to be able to talk to you guys a little bit about what we do with the Wellness and Integrative Oncology program located at UPMC Hillman Cancer Center. So like Wendy said, I'm a nurse practitioner with the program. I just recently became a nurse practitioner this summer. So I've been working as a nurse with Dr. Francis and the Integrative Oncology program for a few years now, but I am newly transitioning to working in a nurse practitioner role now. So that's exciting for me. And I just want to talk to you guys a little bit about what we offer, some of the benefits of the therapies that we offer as part of this program. You know, whether you may be interested in pursuing them through working with me and working with Dr. Francis, or if you are just interested in learning about these modalities in general and maybe pursuing them in a different capacity. I just want to give you some basics on what integrative oncology is and how it could potentially help you. And then I'm planning to end our session with a little activity and definitely some time for questions. So looking forward to it. So I just want to start by defining some terms. So these are terms that you might see used interchangeably, but they do have their own unique definitions. So the first one is complementary. And this is using a non-mainstream approach together with conventional medicine. So this might be doing something like, you know, you're on cancer therapy and you're taking a yoga class, but you may be doing, you know, those things independently of each other. You know, your yoga instructor isn't communicating with your doctor, and vice versa about what's been going on with you. And the second one is alternative, and this is using a non-mainstream approach in place of conventional medicine. So maybe you are not on traditional cancer therapy and you're using something instead to try to treat the cancer. So something like high dose vitamin C is something that we commonly hear people ask about as an example of an alternative treatment. And integrative is combining non-mainstream techniques with conventional medicine so that there's really a cohesive approach towards treating patients. And this usually would involve more communication between the providers. So the doctor may communicate with your integrative providers, and everyone has the common goal towards treatment, helping you feel well, and really having this holistic and cohesive approach towards care. And our definition of integrative oncology is managing the mind, body, and spirit of cancer patients in the context of conventional cancer care, using the modalities of movement, touch, nutrition, and mindfulness, with the goal of addressing symptoms and quality of life. So I want to just talk about an example, just to try and display how these therapies could help someone. So we'll talk about Angie, who's a 44-year-old who has breast cancer, and she was diagnosed 2 years ago. She had genetic testing done and learned that she had a genetic predisposition for getting breast and ovarian cancer. She had surgery. She underwent both breast and abdominal surgeries, and she also received chemotherapy and will take hormone replacement for a period of time. She's told by her doctors that she has no evidence of disease, and she has a good prognosis. She overall, her breast cancer specific survival is about 90%. So this is what she hears from her doctors. However, she continues to struggle with some symptoms. She has pain in her left arm and her underarm and chest wall after her surgery. She struggles with hot flashes, insomnia, and neuropathy after her chemotherapy and along with her hormonal treatments. She also feels overwhelmed, anxious, and depressed, and struggles with fatigue and poor memory too. She also struggles with several existential concerns. She worries a lot about her daughters, both that they could also be carriers of this genetic mutation and that she potentially might not be around to see them grow up. She struggles with her body image and sexuality and has a complicated relationship with food, struggling with her weight and finding that she tires really easily with exercise. She's gone back to work, but has a hard time finding meaning in what she does. So giving you some examples of some integrative methods that she could try to help with some of these symptoms that she's struggling with. You know, a lot of patients, a lot of cancer survivors deal with 1, 2, 3, all of these symptoms and others too. And it's not always prioritized. You know, you hear that good prognosis, but sometimes these symptoms and quality of life factors are not always put at the forefront in trying to manage. So, but we know that that's really important, and that's our goal in our program, is trying to help manage these symptoms so that people can feel better overall. So to address her anxiety and her trouble with sleep and fatigue, a custom yoga therapy program is put together for Angie. And this includes movement, breath work, and mantras. And she can work one-on-one with a yoga provider who also can teach her how to put together a home practice and also connect her with group classes. To help with the anxiety, fatigue, and her mood, along with the chronic pain and body image issues that she experiences, a personal oncology massage therapy program is implemented. And this includes pretty gentle touch and aromatherapy with lavender and peppermint essential oils. And to help Angie with her weight, body image, and complicated relationship with food, a lifestyle nutrition program is implemented, where she keeps a food journal, emphasizes cooking and eating with her family, signs up for a cooking class to spend time with her daughter, and explores local farmers markets. And to address her anxiety, depression, and help with coping skills for the uncertainty she experiences, a mindfulness program is implemented. And a meditation provider helps Angie with a personal one-on-one practice, but also cultivating skills for a self-practice that she can do independently at home. And she uses a journal to record observations and different smartphone apps to help with her at-home practice. So the Wellness and Integrative Oncology program is functions as a consult service. So we are located at UPMC Hillman Cancer Center, but we see patients who are being cared for at other cancer centers as well. And patients who meet with Dr. Lainey Francis as part of this program keep their primary medical oncologist and then have consultations with Dr. Francis. So anyone can get involved by either a self-referral or a physician referral. And the first step is having a consultation with Dr. Lainey Francis. And she's a hematologist and oncologist and has a general medical oncology practice at Hillman in addition to the integrative oncology practice. And she's the director of this integrative oncology program. And she would be prepared for your visit and spend most of the time talking to you about your symptoms, your treatments, how you're feeling, what the goals are, and help create a custom symptom-based care plan to move forward. So we really try and focus on on symptoms that we can help with by implementing these therapies. And then at that point, we would connect you with our integrative providers that are on site with us at the Hillman Cancer Center to get started receiving these therapies. And Dr. Francis communicates with the integrative providers in order to uphold our standards, safety, and supervision of the therapies that are being provided. So that's one of the really nice things about meeting with Dr. Francis and the providers that we have on site is that everything is supervised by Dr. Francis, and she and myself are available to our providers in case there's any concerns or questions about the specific care plan for that patient and maybe any specific restrictions or goals. You know, we are available to help with that. And then throughout the process, we communicate and just in order to evaluate, sustain, and expand on the care that you're receiving through our program. So we really try to emphasize communication and assess how things are going along the way and see how we can best help. So the therapies that we offer on our site include oncology massage, acupuncture, exercise therapy, lifestyle nutrition, and movement and mindfulness, which is another way of describing yoga. But we tend to not always call it yoga just to avoid, you know, previous potential misconceptions about yoga and, you know, people having to wear designer yoga pants to come and do that. So we try to keep that a little bit more open-ended as it's very personalized and includes some movement and some mindfulness in each session. So this is our home. We lovingly call it the Wellness Suite, and it's home to our consult service where Dr. Francis works, as well as our integrative provider. So in the back of that picture, you can see like a treatment bed set up. So we have 2 therapy rooms like that that are set up back there where we can offer the acupuncture and massage, and the yoga sessions also occur in those rooms. And we are working on building a larger space, which is also going to be on the 3rd floor of the Cancer Center. And it will include all of these things that we currently offer in addition to a teaching kitchen and group spaces where we hope to offer some exercise and different types of group meetings. And we are expecting it to be open next spring. So I just want to revisit each of these therapies and just tell you a little bit about each of them and what the benefits of them are. So for all of the therapies that we offer, they're very customized for the individual. So all of our therapies are one-on-one at this point. Eventually we'll be offering them in a group setting. But for now, it's very personalized to the individual. There's a lot of follow-up to assess how they are, the symptoms that we're hoping to treat. And they are very symptom driven. So you'll see on my coming slides what symptoms we hope to address with each of these therapies. And the therapies are also evidence-based. So as much as we can, we reference evidence and research to support use of these therapies. But unlike medications and different types of conventional treatments, there's not as much research out there on these integrative therapies. So we use the evidence when we can, but we also take into consideration a lot about personal preference and what we have seen that works for others. So the first one I wanted to talk about is oncology massage. So massage is pretty common. I think, you know, I expect a lot of you might be familiar with what this is like. So I'll just explain, sort of how oncology massage is unique. So a traditional massage is the manipulation of soft tissue of the body to establish and maintain good health and promote wellness. So this can be a lot of different things. There's deep tissue massage, there's Swedish massage, aromatherapy, hot stone, all kinds of different types of massage techniques. But the thing that sets oncology massage apart is that traditional massage is modified to safely work with cancer and treatment-related complications. And obviously that's different for everyone. Everyone deals with different complications and considerations associated with cancer. So having Dr. Francis' oversight is really helpful in identifying what those personal factors are and communicating them to our massage therapist so that she can work with each individual appropriately. I would say it has more of a gentle approach. So the touch is definitely more gentle. If you would not find any kind of like deep tissue, intense massage therapy going on in an oncology massage. But it's very therapeutic, very relaxing, and here are the benefits. So for each of these therapies, I'm talking specifically about people who have cancer. So we can see reduced symptoms of pain, fatigue, stress and anxiety, nausea, and trouble with mood with oncology massage. Okay, and that brings us to acupuncture, which I would say this is probably our most popular therapy that we offer in the Wellness Suite. And this is the practice of inserting a very fine needle into the superficial layers of the skin to improve how the body functions and to promote healing. So I put this picture here. You might have to look pretty closely to find that needle. So this is Karen, our acupuncture therapist, placing a needle on one of our nurse ambassadors at our nurse training. In her forehead, just between where Karen's pinching her fingers. So you can see the needle is really, really fine. Karen likes to describe it as the thickness of a cat's whisker. And it goes into the very superficial layers of the skin. I think a lot of people associate needles with things like ports and IVs and those crazy pictures of athletes that you see with inches long needles sticking out of their back all over. Excuse me. But it's really, the needles are really fine and are not very, do not cause very much pain when they're being placed, if any pain. So another question is, a lot of people ask, how does it work? So acupuncture is within the scope of traditional Chinese medicine. So there's sort of your Eastern definition of how it works, and then there's sort of a more Western definition of how it works that sort of makes sense to, either both definitions make sense to different people, I suppose. So the Eastern definition is that within Chinese medicine, there's a belief that there's energetic pathways called meridians that are running through the body, and acupuncture is believed to open these pathways to promote healthy body function. Now, the more westernized definition is that the needling stimulates the nervous system, and that in turn releases chemicals into the muscles, spinal cord, and brain that can change the experience of pain or trigger the release of other chemicals and hormones that influences the body's internal regulating system. So there's a lot of benefits of acupuncture. A lot of physical benefits. There's also emotional benefits as well. So one very common symptom that we treat is neuropathy. So chemo-induced neuropathy is unfortunately pretty common and difficult to treat. So that's one of our popular symptoms that we use acupuncture for. And then also GI issues. So things like constipation, diarrhea, nausea, acupuncture can help with that. Anxiety, depression, lack of energy, insomnia. These are more of the emotional types of symptoms that we can help with. Also physical pain. So any type of pain, back pain, other muscle pain, pain around the mouth and throat, also pain and headaches. And then another interesting one that we can treat are hot flashes and other symptoms associated with hormone therapy, both for men and for women. And this is something that you can see people who benefit can see a really tangible benefit. So for example, instead of having 25 hot flashes today, I've had 10 hot flashes and they were 50% in severity. So that's pretty cool to be able to see. You can really sort of like quantify that. So the next one is exercise therapy, and we offer individual sessions with an oncology certified exercise trainer. And this starts with a fitness and exercise assessment, which encompasses a discussion about diagnosis, symptoms, previous and current activity, also goals and lifestyle. And then she would guide individuals through a supervised resistance training and coaching session, and also provide an exercise plan that would include suggestions for follow-up. So she commonly gives sort of a little package with a plan of exercises to do at home or at the gym, not as much these days, but something that people can take home with them and do independently, and then touch base with her as needed. So the benefits of exercise are seemingly endless, and I include some of them here. So it helps with symptoms like self-esteem, depression, anxiety, neuropathy, lymphedema, and fatigue, but it also helps with physical function. So it helps the body work well. So it helps with muscle mass, it helps reduce osteoporosis risk, it helps with balance, and helps reduce fall risk. So nutrition, I think a lot of us have access to medical nutrition therapy as part of your cancer journey, I hope. But we offer that at Hillman as well. Through our program, we offer a little bit more in-depth lifestyle nutrition counseling. So this is a definition here that our dietitian likes to use to describe lifestyle nutrition. And she says, many medical conditions occur due to stress and poor dietary habits. Nutrition therapy is the science of proper diet, lifestyle strategies, and therapeutic nutrient intervention to correct nutritional insufficiencies, promote health, and prevent, manage, or correct medical problems. So she really tries to help incorporate nutrition by looking at the entire lifestyle, past, present, and future.
13 new deaths that were announced, 9 linked to long-term.
These are her sort of guiding principles. So she always provides the most recent
response from the state and the county
research.
Yeah, we turn off our TVs.
In the coming weeks and months.
Okay, go ahead, Kayla.
Okay, thank you. Angela, our dietitian, her approach is pretty simple, non-judgmental, very open-minded. So trying to meet people where they are and really find something that will work for them from a nutrition perspective. She promotes a well-balanced eating that's predominantly plant-based. And she advocates for fresh and local nutrition as possible. And the support she offers is, again, very personalized, and it can be focused, on what that individual is looking for, what they need, and it can be, it's different for every person, and it can be focused on question and answer. It can be, she can talk more about symptom management, talk more about specific diets and how to modify them to fit
And to make the tough calls. She's left.
One second. I know. Right. I'm trying to, I think they're muted now again.
I think so too. I don't hear it.
I know. If you guys can make sure that you're muted, that would be helpful, because if you're not, then it will overpower Kayla. Thank you.
Thank you. So then that brings us to yoga. And like I mentioned earlier, I think a lot of people can have preconceived notions about what yoga is. It's in a 100-degree studio and everyone's wearing, you know, designer athletic gear, but it's really not about that. It's been very commercialized in the past 10 to 15 years, but it really comes down to awareness of the self first. So you start by just noticing, naming what's happening in the mind, body, and breath, and following up on that by taking careful action based on that, what you learned by noticing. And it's really at the core, yoga is just the simultaneous practice of two or more of the following elements. So if you're moving in some way, if you're breathing in some focused way, and if you have a deliberate focus of the mind. So if you take any of those two of the three components, you're practicing yoga. So it's really pretty simple, and anyone can do it. You can do it on your couch, you can do it in a hospital bed, you can do it on a yoga mat. And we really work with people to use this as a tool. And the benefits are experiencing improvements in anxiety, mood disturbances, depression, sleep, trouble with memory, fatigue, and then overall quality of life and vitality. And then our last therapy that I wanted to talk about is meditation. And this is commonly combined with yoga. And one definition of this is paying attention on purpose with a non-judgmental attitude. And there's three components. So intention, so setting a purpose for your meditation. Attention, so focusing your attention on something specific. And attitude, so having a non-judgmental attitude while you practice. It's just having a open-minded approach to the meditation. And I'll talk about a few different methods for how to incorporate meditation, but with any of them, just regular practice is key. And I think a lot of people can get discouraged by practicing this, you know, once, twice, or a handful of times and thinking like, oh, I just can't stop, I can't clear my mind. But it's really okay if you can't clear your mind, and that's sort of just part of the process. And instead of trying to completely clear your mind, just being aware of the thoughts and not engaging with them necessarily. So maybe thinking of your thoughts as a cloud, you know, passing in a blue sky, and noticing them and then moving on and letting them go. But I think a lot of people get discouraged by not being able to stop thinking. And that's not really the ultimate goal. It's just to be aware, bring your awareness to this moment, and bring a little bit of a sense of calm. And then, you know, with anything, this regular practice of this meditation is really helpful in finding the benefits for yourself. So this can look very different. There's a lot of different ways to meditate. And the most simple one is creating a self-guided practice. So you can do this without even anyone around you knowing. You can be sitting at a desk, you know, with other people around you, with your eyes open, and you can be practicing this, doing a 1-minute meditation. You could set up a little spot in your house we're all spending a lot more time at home now and maybe doing some home improvement. You can set up a little meditation zone in your house, maybe with a candle and a pillow that you sit on, and that's your little meditation spot. And you can spend 5 minutes just breathing, closing your eyes, and bringing awareness to the sensation around you. On the other end of the spectrum, there are structured courses called mindfulness-based stress reduction. And these are typically courses that are about 8 to 12 weeks long to really go deep into meditation practice. So that's another option as well. And I know that that these courses are offered at UPMC. They're often offered at different wellness centers. I'm not sure if, Wendy, you guys have ever offered anything like that before, but sometimes you'll see them offered like at a YMCA or different places like that. Mm-hmm. So a bunch of meditation apps out there. So if you have a smartphone and look at the App Store, you'll see so many different meditation apps. And the one that I like best that's available on the App Store is Insight Timer. And that one is really nice because you can do guided or unguided meditations. So you can start with a guided meditation. They usually have some beginner courses that help walk you through getting started with meditation. There's also like an unguided one that plays some relaxing music and makes the sound of a gong whenever your timer is up. So that's really nice too if you don't necessarily want to hear someone's voice throughout the meditation. And then this colorful image that's on the right is a web-based meditation app that Dr. Francis developed along with the creators of another meditation app, which is called Buddhify. But this is called Kara. So the first 4 meditations you see listed are kindness, awareness, rest, and allowing. And that's the namesake of Kara. And those are pretty general meditations, and all of these are relatable to people who are affected by cancer. So people who have cancer themselves, caregivers, staff, other coworkers that I work with can relate to these meditations. And you can access this at thisiskara.com. And you can usually save it, depending on what type of phone you have, you can usually save it to your home screen so that it functions like an app. And it's really nice. The meditations are usually 15 to 25 minutes long. And I always suggest, if you're new to meditation, starting with one of the first 4 or the I can't sleep meditation to help just guide you into a really nice restful sleep. That's a really good one to start with while you're getting used to listening to meditations. And then the Cancer Caring Center also offers a weekly movement and breathing session with SADIE GROSSMAN, who works as part of our program. She's our yoga and meditation provider with Integrative Oncology. So she offers a lovely, gentle movement and breathing session on Zoom every Saturday at 9 a.m. So if you're looking for more details on this, I'd suggest reaching out to Wendy. I think this is a great way to get started if you're thinking about trying to incorporate a little bit of yoga, breathing, meditation into your life. So the benefits of meditation are many as well. So it helps with stress, fatigue, sleep, vasomotor symptoms, which are essentially hot flashes, depression, pain, anxiety, helps to improve quality of life and just an overall sense of peace and meaning. So I'm hoping that you guys would indulge me in a little meditation practice we can do together. And then I will most definitely allow some time for questions. So if you could just find a comfortable seat. If you're driving right now, you might want to tune me out a little bit so that you can stay safe while you're on the road. But if you're not, I just ask you to find a comfortable seat. You can be sitting down. You can be laying down. If you're sitting, it feels nice to sort of just firmly plant your feet onto the ground. And just start by becoming aware of your natural breathing. So notice that inhale and exhale that just occurs naturally for just a moment. Not trying to change it. And then go ahead and take a deep breath in through your nose, allowing your stomach to expand. Holding your breath just for a moment at the top, and then slowly exhaling out of your mouth, allowing your body to completely relax. And keep breathing in this way, taking a deep breath through your nose, expanding through the stomach, and then exhaling out your nose or your mouth slowly. Consciously slow your breathing down with each breath. Breathing in through your nose. Hold for just a moment. And then exhale. And breathe in. Hold. And exhale. And on your next breath, see your breath as a warm, healing light. As you inhale, fill your body with this warm, healing light. And as you exhale, release tension, allowing your body to release even more into the bed or your chair or your seat. And inhale that warm light, and exhale, easing tension, releasing your jaw, releasing your tongue from the roof of your mouth, and easing into your seat even more. And next, bring your awareness to your feet. Taking a deep breath in through your feet. Imagining that warming light filling your feet. And as you exhale, letting them be heavy and release any tension into the ground. And continue breathing that way. And we'll gradually move up towards your head. Breathing in that light and bringing awareness into your lower legs. Seeing that warm, healing light travel into your legs and releasing all the tension and stiffness. Any tension in your calves is now being released down into the ground. And your breathing is becoming even more slow and rhythmic. And breathe in the light and watch as it travels into your upper thighs, releasing all the tension on your exhale. Any tension in your thighs is being released. down through your lower legs and your feet and into the ground. Bring your awareness to your hips and pelvis, breathing in the warm light, seeing it swirl around your hips, and exhale any tension, allowing your weight to relax even more fully into your seat. And just taking another breath here, inhaling that warm light and exhaling tension. And take another deep breath in, visualizing the light coming in and traveling up your spine. Your spine is filling with light, releasing any tension in the discs and joints in your back. And taking another deep breath in here and exhaling any tension. And bring your awareness to your stomach, breathing in and allowing your stomach to expand with that light. Breathing out, releasing any tension here. Breathing in, expanding with that healing light. And breathing out, relaxing even more. Breathe in the healing light and watch as it travels around your chest and your heart. As the light swirls around your heart, notice as your heart begins to open. And breathe in again here as that light fills your lungs. And exhale with more relaxation. And take your awareness to your throat and neck. Breathing in, filling with warm light. Breathing out, releasing tension and embracing this sense of relaxation. And finally, bring your awareness to your face and your head. Breathe in the light, filling the features of your face. Breathing out, allowing any tension in your forehead, your eyes, your jaw to release. Your face is completely relaxed and filling with light as you take another breath in and out. Now visualize a stream of this warm healing light traveling into the top of your skull, at the top of your head. This light travels down throughout your entire body and fills your entire body with a warm and healing light. Allowing this light to go to any parts of you that need a little extra healing tonight. Allow this warm light to completely surround you. Your entire body is now full of warm, healing light. Notice as it expands beyond even your physical self. See the warm light and feel as it expands beyond this room, beyond the building that you're in. Your body is feeling very relaxed now, and your mind is clear and focused. Your emotions are calm and content. And rest here for 3 more breaths. As you inhale, hold, and exhale. And inhale, hold, and exhale. Inhale, hold, and exhale. And when you feel ready, just gently bring your awareness back to your body. Return your breath to normal. Just noticing what that feels like. Bring awareness back to the room that you're in. Noticing any sounds, any smells, any sensations. Giving your fingers and toes a little wiggle. And you can gently open your eyes and return to the space we're in. So thank you for joining me on that, especially if that was your first time trying something like that. So I think it helps for us to help us feel like we're together. So if you're able, after that, I'd be happy to take some questions about our program. I'm going to put our contact information here. And I'll just start by reading the phone number to you. It's 412-623-5771. If you're interested in reaching out and learning more. There's also a lot of information on our website. If you would like to learn more that way. So I'd be glad to take some questions about anything at all. So please feel free. I'm gonna stop sharing so that I can see your faces.